Hello again, everybody. Welcome to the NSPA's first webinar, Reaching and Supporting Men During COVID-19. We're really excited to be starting this set of webinars, and we will be planning and putting in place more over the coming weeks. So for those of you that don't know me, I'm Penny Foston. I'm the executive lead of the NSPA, and from early on during lockdown, we started running a whole suite of online discussions. So not webinars, smaller conversations for 20, 25 people to share concerns, challenges, plans, ideas on reaching all sorts of different populations, on coping with all sorts of different challenges. And one of the populations that came up quite quickly that people were concerned about reaching was men. And the sorts of issues that people shared during that conversation were that they felt that, well, help seeking was down across the board, but they were particularly worried about men not seeking help for physical or mental health concerns, that anxiety levels were up, and that even relatively early on, there were men getting in touch who had concerns about financial issues, using up their savings, already getting into debt, and that affecting relationships and all sorts of other aspects of their life. And also that sometimes you can tell if someone's struggling because you're seeing them every day. And obviously with everyone moving to, well, so many of us moving to home working, that was harder to find out. You couldn't spot people over the desk or at a coffee break. So we shared ideas then, and actually Ellen O'Donogue, who you'll hear from later, was part of that conversation and shared some of her thinking. But we really felt that there was a huge demand, and so we decided to put on this webinar, and we were right, because over 145 people have registered to attend today, which is fantastic. So welcome all of you. We've actually got a little poll that my helpful team in the back are about to launch, to just find out if you could just say which sector you're coming from, because we've got a huge population joining us today, and it's just really interesting to hear where you're all coming from, and therefore what perspectives we can be making sure we're including. Oh, look, great. So lots of people from charities, but a good proportion from public health, local government more broadly. Fantastic. We'll keep that up for a minute while more people are still joining the webinar. So those of you that are just joining, please do join the poll and let us know where you're coming from. Just a couple of pieces of housekeeping. So some of you are already very effectively using the chat function, so please do join in there to make comments, to say hello, to say thank you, but we also have a Q&A box, so please use that for all of your questions, and we will be using that to look at what questions people have, to highlight the key ones that we will be able to answer, and I will be asking as many of those as I can of Joe and Ellen after they've done their presentations. So yeah, please do use that Q&A function for all of those questions that you've got related to reaching and supporting men. But we'd be really interested in hearing your responses and perspectives in the chat function to what you're hearing from Joe and Ellen, and if that chimes with what you've been finding, or if you've got different perspectives. So please do join in with that. Okay, I think we'll end the poll now. So really interesting. So lots of people from charities, and as I think you should all be able to see, it's a good spread from across the board, actually. So it's really fantastic to have all of you here. Thank you so much. We're really delighted that we're meeting a need, and we hope that you'll find this afternoon interesting, informative. Yes, Joe Potter from Samaritans and Ellen O'Donogue from James's Place are both fantastic and highly informed and insightful people. So I'm really looking forward to hearing what they've got to say. And so at this point, I'm going to hand over to Joe from Samaritans.
Thanks very much, Penny. Slightly strange experience knowing that there are many of you out there and not being able to see any of you, but thank you so much for having me. My name is Joe Potter. I'm Policy Manager at Samaritans, we have a particular policy interest in this group. And while Ellen's presentation is going to focus very much on sort of operational, reaching people through services, my presentation is similar, but from a policy and a research point of view. So if we could have the next slide, please. So the bulk of the presentation is going to be based on this report, Out of Sight, Out of Mind. It was published earlier this year, pre-COVID, it should be said, but many of the themes that came through in the report have a particular resonance and are particularly relative for the COVID age, unfortunately. One of the things I'm going to try to be doing is to bring through some insight from Samaritans helpline, and sort of pointing out where there is some sort of concerning overlap between what we found through this research and what our data from the helpline is telling us. Could have the next slide, please. So this slide really just speaks to, and many of you will be really well versed in this, but why Samaritans, why all of us are so concerned about this group, middle-aged men, when it comes to suicide. The figures for 2019 that came out last week or the week before last, the ONS stats back up that, again, it's men who are 3 times more likely in England and Wales to die by suicide compared to women, and that the middle-aged men being the highest risk group is persistent, has gone on for decades, and that this is really also an issue of inequality and deprivation. So the poorest men in the most deprived areas are 10 times more likely to die by suicide than more well-off men from more affluent areas. Obviously, there are notable exceptions to this, but as a general trend, this really is an issue of disadvantage. Thank you. Isolation and loneliness is going to be a sort of a feature of this presentation, and it was certainly a feature of the report. So there being an association between suicide and loneliness, we've known for a while. I'll come on to a bit more of this later in the presentation. If we could just have the next slide, please. I think it's really important to say that there is no single reason. Again, this won't be a surprise to many of you, but there's no single reason that alone that men take their lives. There are myriad reasons. It's a complex issue, but we know there are some issues around men being more likely to engage in risky behaviour when struggling, a tendency to have fewer strong social networks outside of their relationship. Then the second point down, that men can be less open to talking about emotions and have fewer social skills than women. It's something that comes up in the evidence, but actually Ellen's presentation will come on to some interesting challenges to that. That definitely needs to be the idea that broadly men don't talk. I think definitely needs to be challenged, and it's something that came through in our research, but comes through more strongly in Ellen's presentation that follows mine. If we could have the next slide, please. So, as I said, this research, Out of Sight, Out of Mind, took place before the COVID outbreak. But actually, unfortunately, it reflected a lot of what the caller data, which I'm going to go through, sort of tells us. So, forced isolation, disconnection, even before lockdown, were major problems for the group of men that we're talking about here, middle-aged men on lower incomes. So we found these men to be really disconnected from the people around them, the places around them, from networks around them. And, you know, of course, that are just going to be exacerbated in many cases by lockdown. What we're starting to see at the moment around job loss, it's really starting to ramp up at the moment, and we know that the furlough scheme ending is likely to have an even bigger impact with that regard. You know, out of sight, out of mind really showed us how important work is, not just financially, but also socially to this group. So again, the issue of being disconnected from networks is likely to become a bigger feature of, and probably not so well spoken about, but a sort of a continuing feature of job loss also. The next slide, please. So Samaritans has undertaken a survey of our volunteers, 3 surveys of our volunteers in March, May, and the most recent being in June. It's probably unsurprising and echoes what Penny said, that people are more anxious and more distressed than before the COVID-19 pandemic. Specifically for the issues we're going to be speaking to in this presentation today, many callers have been worried about losing their jobs and businesses, as well as being furloughed. And actually what we're hearing is from the people from the people running our helpline, is that now those fears about the future, losing a job, losing your business, these are actually starting to come to fruition now. So they're transferring from fears to actuality, and we're getting more calls about that. You know, anxiety around being unable to pay rent, mortgage, and inability to support the family, which we know for many middle-aged men is such a important source of identity. And so again, there's the financial impact of losing your job. There's also a sort of loss of self, which is particularly important for this group. Fear of homelessness, all of these things that unfortunately now are starting to become more likely. Have the next slide, please. A lack of social support. So again, this is probably unsurprising, but you know, a reduced access to previous social networks, but also, you know, just the you know, popping into shops, the less formal side of socialization that people have, but are losing. The very, you know, speaking to someone in your local shop, or just being cut off from the world, around you is something that comes up again and again in the service. If we could move to the next slide, please. And a lack of access to mental health services. So people are telling this is an increasing problem, even as services start to come back online. That can be quite patchy. It's not working for everyone, and that actually services like Samaritans, the Samaritans helpline, is stepping up where more formal clinical services would have formerly taken that role. So yeah, it's another distressing, and a lack of access to support is something that came through really strongly in Out of Sight, Out of Mind. If we could move on, please. So Out of Sight, Out of Mind is going to be the sort of the bulk of this now. So again, if we could move on to the next slide. We undertook 16 in-depth interviews with middle-aged men across the UK and Ireland. So really trying to dig down into their experience. We wanted to go for the depth rather than the breadth of experience here. So we really wanted to understand what these men wanted from services when they were struggling, what they were getting, what they weren't getting, how their needs were being met or not met. The current evidence base, there's lots of good work going on. There isn't necessarily a truly strong evidence base to back that up. And that's what we're trying to add to. And that last point, exploring what these men told us worked for them when they come into contact with support services, was the key, the crux of this report. We found that away from services, long-term stable work was really important in terms of routine, purpose, and providing a social network. And that actually, we spoke to these men when they'd been through a crisis, and when you tracked that crisis back, there were many reasons for it, but ending of work was really a common theme for that. And obviously, knowing what we know about forthcoming redundancies and recession, that should be of particular concern. So George, one of the research participants, said that he completely underestimated the impact of his work ending. You know, his colleagues had become his friends and a big social network, and when he lost that, it was you know, had a massive impact on him. Next slide, please. Social disconnection was incredibly important for all of the 16 men that we spoke to. I definitely thought that we were going to hear more stories of the impact of directly of poverty, of loss of income, of you know, and that was of course part of the story. But I think if there's one thing I took away, it was about a lack of connection that these men had. And actually, again, as you trace their experience and their journeys, as it were, what you see is a slow but sure dropping off of connections from when they were in their 20s right through to their 40s, 50s and 60s. A striking feature was about the years that these men struggled with poor mental health, with suicidal thoughts, with suicidal feelings, and in some cases attempts. And there really just being no support network around them, despite this sort of long chronic problems that they were having, where some people did have good social connections. Unfortunately, this wasn't always the case, but in some examples that really stood out, those connections were based around substance misuse, alcoholism, so they didn't necessarily have the protective factors that you might hope social networks would provide. We could move to the next slide, please. Ian told us that he was embarrassed to talk about depression with other people, very isolated. He was alone and didn't have anybody or see any way of having anybody. Next slide, please. From a policy point of view, it's really important to note that there were opportunities to engage these men way before they met crisis. There was, you know, an example of a guy coming in and out of the in and out of prison, go to the job centre, addiction services, lots of places where you think, okay, this is an opportunity to intervene and to help this person get back on their feet. But again and again, we had stories of those opportunities being missed. So support being framed narrowly also when it did arrive. So looking at, for instance, substance misuse without asking the men more holistically about what they were going through and what they needed. So of course, substance misuse is something that needs to be dealt with, and the man needs to be supported through that. There was a whole other set of issues around disconnection, around purpose and meaning that just didn't get spoken to. And really crucially, the men that we spoke to didn't see services that were about sort of helping to get them back connected with their community. They weren't seen as relevant until they reached a crisis point. Next slide, please. So crucially, what should interventions focus on for this group? The men told us that inclusive initiatives based on peer support and shared experience were really important. So when they walk into a service, when they get referred or self-refer into a service, they want to feel like the people around them have some sort of sense of shared experience, that the person at their side understands what they're going through. They want to feel also that what they're doing is organic. It hasn't been a local CCG, or it doesn't feel like the NHS has decided there are a lot of vulnerable men in this area. We're going to put a service in here and we're going to make you better. It was important that the services, the initiatives they got involved in felt organic. Next slide, please. George emphasised this, one of the research participants, with the importance of it. It doesn't matter what the activity is, it's about having a commonality, a common feeling they want to do this thing together, be that crochet, be that football. Next slide, please. purposeful goals were really, really important. This is what the men told us too. You know, the men that we spoke to didn't want to feel like the beneficiary of a service. They wanted to feel like they were working together to achieve something, to work towards a sort of common goal, a common good. They didn't want to feel like they were being fixed. They were willing to speak about what they'd been through, how they were feeling, but they didn't want that to be the focus of the service. That needed to be a happy offshoot, the kind of byproduct of working together, getting involved in something that they felt that they could contribute to. That the talking about how you feel will come as an afterthought, an important but afterthought. And by focusing on projects, by focusing on contribution, you can kind of help to sidestep the issue of stigma, the issue of what's wrong with you, how can we help fix you because you are broken. That's what you want to move away from. Next slide, please. Tom told us, you know, it's about getting perspective on his life by speaking to others. It's by helping other people that he could kind of help himself. And obviously, this won't be the same for everyone. There will be some people who need mental health support, you know, and counselling and that sort of stuff. And it's important that the people that require that get it. But for the men that we spoke to, it was a kind of a different route to feeling better. The next slide, please. So Jack told us it was about, he felt that people could rely on him. You know, he was trusted, he was contributing to something. That made him feel so much better, having responsibility, not being able to care for others rather than being cared for. So a really powerful quote to end it. I think I'll finish up there and hand over to Ellen. I know there's going to be questions at the end.
Thanks, Joe. Really, really great. And there are already some interesting comments in the chat function. Some of you are just sending your messages to the panelists rather than to panelists and attendees, but certainly someone's talked about men's sheds, which are a fantastic project, exactly the sort of thing you were talking about, Joe. Practical, constructive, and you get to talk to people and whilst you're making things and creating things. And I think that's a really interesting project that Liz Howlett identified, and I'm sure there are many more out there. So please do share your thoughts in the chat function of the kind of projects that you think would meet some of those needs. And we'll hand over to Ellen from James's Place to hear from her. Thanks, Ellen.
Thanks, Penny, and thanks, Joe. As Joe said, I think hopefully this will be quite a useful run-on from his presentation, because I'm going to be talking about the work that we do and that we've done in other organisations to reach just the kinds of men that Joe's been talking about. And I think if we can move on to the next slide, please. We support men in suicidal crisis at James's Place, and that's because men are 3 times more likely to die by suicide, as many of you will know. And I think COVID has put huge pressures on people, on services, on all kinds of people across the board. And I think from a service delivery perspective, what everybody is trying to do is really learn quickly and implement fast. And that's not always easy for services. And so I'm hoping that in this kind of the whole session that we're having today, we can explore some of the kinds of things that will help when thinking about reaching men specifically. And while I'll be talking about our work at James's Place, I'm also going to look back to a range of roles and jobs I've done over the last 20 years. And just to give you kind of a bit of background to contextualise that, I worked in kind of commercial agencies for the first decade, and then I moved to Public Health England, where I was head of the strategy and planning team, so developing their behaviour change campaigns and also evaluating them. I also worked at November delivering global campaigns on men's health promotion before a brief stint at the Royal Foundation and then James's Place. So I'll bring some of those examples in. And I think overall, we'll be looking at how do you reach men? How can a service best support them? But also what are the potential barriers to that? And I think it's worth just saying as a kind of caveat that obviously men aren't all the same. So we're making some big generalisations here, but hopefully those generalisations can help us to shape the work we're doing in the best way possible. So if we can move on to the next slide, just to give you a little bit of background on James's Place. James's Place offers a non-clinical setting for men in suicidal crisis, where we deliver a proven and evaluated model. And so what we're really trying to do with a man who comes to James's Place is understand how he's got to this point of crisis, how he can get through it, how he can stop it happening again, and what kind of steps can be put in place to keep him safe. And I think it's really important to note that while we are seeing men to some extent at that kind of apex point, so we're seeing men perhaps at their most vulnerable point, what we can learn from them can inform the way that we develop prevention activities and early intervention activities across the board, because I think we do see some really powerful and important insights. Another point is that at James's Place we always engage a supporter, so friends and families in the care of the men that we see. And that's really crucial. In Liverpool, for example, where we operate our first centre, we take self-referrals from some men, and a lot of those referrals will be coming via a third party, so a mother, a girlfriend, a sister, whatever. And I think what's really key when we're thinking about this from an outreach perspective is that the pool of people we want to influence is perhaps much wider than the individual themselves. And so when we see this man experiencing suicidal crisis, what we're really trying to do is help him to find a renewed sense of hope. And Jane Boland, who developed the intervention at James's Place, and I think is on this webinar, though I can't see her, which is strange, described it really beautifully on World Suicide Prevention Day, where she said that if a man has come to see suicide as the answer, we want him to know that there are other answers, that there are other ways that things can move forward. And that's what we do at James's Place, and what I know a lot of you on this call here today will be working on. So if we can go on to the next slide. As Penny said, we first had this kind of conversation in a slightly more informal setting during lockdown. And in that, I was looking at some of the myths, I suppose, around reaching men. And it's a key myth, as Jo said earlier, that men don't talk. And myths are myths for a reason. There's often some fairly significant elements of truth in that. But I think, as a first and obvious point, men do talk. Men talk all the time, but not necessarily about what we want them to be talking about. And I think there's a real danger of reinforcing some of these negative behaviours by taking some of these things as read. So, yeah, that, I think in Movember, which was a kind of although it was a global organisation, it had a very strong Australian base. That's where the head office was. They used to talk about the stoic male. And I think there's a real issue that if we perpetuate this idea that men don't talk, we're actually potentially making it harder to reach men. And so how you ask the questions is key. And our intervention at James's Place starts with this kind of provision called lay your cards on the table, where we have a whole set of printed cards that might be things that men are thinking, doing, feeling. And it helps them to articulate right from the very start. It helps them to recognise that what they're feeling isn't completely, out of the usual, but it also helps them to speak to some extent when speaking is really hard. And once you've done that, I think how you hear the answer is also vital. So we need to make sure that men do feel heard when they speak. And I think sometimes when we say that people don't talk, what we're often saying is that we don't quite understand what they're saying. And I think that it was before my time at Movember, they developed this really lovely piece of content around suicide notes, where men wrote notes that they had never used. And in the research that led up to that, which was mainly done in Australia, a lot of men that they spoke to who had gone on to either attempt suicide or had reached that kind of suicidal point said that they had sought help, or they thought they'd sought help. They thought they had told somebody, they'd reached out, but they didn't get the response they needed, either because someone didn't understand or because somebody was reluctant to kind of hear what they were saying. And so I think it's really, really critical that we all, thinking about this from a kind of service delivery and an outreach perspective, look at the different ways that men might be speaking. And practice really matters. So many of the men we see at James's Place are not used to talking about their feelings at all, let alone their negative feelings. And so how we start earlier is a really key question, I think. So I've included this picture from Inside Out, which I think is a brilliant film for kids, and it probably adults too. And what it really brings to life is this way that different kind of feelings and emotions work together. And I quite often use it with my kids, talking about the difference between anger, who you can see here, and sadness, and how important the interrelation is. So I think I went too far, because my son, when I last tried to raise it, said, "Mum, I wish you had never seen that film," which was obviously unfortunate. If we can go on to the next slide, are men hard to reach? Again, I think hard to reach is such a tricky and disputed phrase. So even by the time I was at Public Health England, which is a while ago now, it was recognised that hard to reach is probably not the best way to phrase it, because really what we're saying is this is a group or a person that we don't know how to reach, or they're not listening to us and we don't really understand why. And I think one of the key things that we see when we really dig into what's happening with the way that men understand some of the messages, some of the outreach, some of the communications that's directed towards them, is that they might have heard what we said but understood something else. And I think we saw at James's place, and I think it was seen more widely across the sector, a real change in referral patterns during lockdown. So we saw a real drop-off in people coming to us from A&E, and we also saw a big drop-off, I think, in people attending A&E. I think it's worth mentioning that the same thing was seen in heart attack and stroke. So roughly the number of strokes stay the same year round, and yet during lockdown, presentations at A&E from stroke dropped by 50%. So there was something really significant happening. And whilst I'm not criticising the messaging in any way, but you can see here I've concluded that little graphic of stay home, protect the NHS, save lives. It's very clear that this was a pandemic response messaging to us when we look at it in the kind of cold light of day. But I wonder if some men heard stay away from A&E when they saw that you are doing something useful by freeing up services for other people. And so that's a really classic example, potentially, of men hearing what we're saying, but understanding something else. And I think even if people do understand what you want them to do, that's not always enough, because they can adapt to systems and make them work to their own advantage. I can show how long ago this is, that it was a piece of work for a PCT when I worked in consultancy, but we were looking at how people interacted with urgent care services, and particularly inappropriate use. And we spoke to some GP receptionists, and they gave us examples of people attending inappropriately. One man came and just shouted in the waiting room that he wanted to see the GP, and did that fairly regularly. Another man lived nearer to the GP than the pharmacy, and so he, when he cut his finger, he turned up and asked for a plaster. So the interviewer saying, "Well, what did you do?" And they said, "Well, the GP saw him and we gave him a plaster." So that's a kind of a system almost adapting back to meet the way that it's being used. And I think we need to be really conscious and careful during COVID that we don't create some of those loops in the system. Worth mentioning virtual reach. I think it's often seen as a golden bullet, but to some extent it's a noisy platform, that there's a lot of demand for people's attention at the moment, and they can respond in quite surprising ways. And if anyone's interested in the kind of Q&A, we can talk a little bit about some of the more kind of advertising things. That there's real evidence that if you want people to change their behaviour, then social media might not be the best way of reaching them to do it. And then I wanted to make one really critical point about people's prior experiences of services, because these will vary hugely, and they will very much change the way that people interact with services across the board. I did a piece of work years ago for the Equality and Diversity Council in the NHS, and we were looking at people with the 9 protected characteristics and what they wanted from the NHS. And what they all said, what they all wanted was the same stuff. Everyone wants to be treated decently, with respect, and specifically. But their experience had often been very different, and their experience then shaped what they expected the service to deliver and how they expected to be treated. And so I think when we are trying to reach men, particularly in these very difficult and confusing times, there's a real danger that we don't take into enough account what their prior experience of interacting with people like us and with other kinds of services are. So just briefly, if we move on to the next slide, how do we then design the right pathways? Well, we need to make sure that people know that a service is there for them. I've talked about a kind of half myth that you reach men through women. I think it's true that women are often more engaged with health services, but COVID has totally disrupted everyone's habits and behaviours. And this offers huge opportunities, but also significant risks. We're all eating differently, exercising differently, socialising differently. And I think that gives us the chance to intervene for the better, but it also means that it's very difficult sometimes to predict how people will behave. setting is very important. I won't go into this because Joe's already covered this, but we do know that men respond better to interventions in places they see as safe, as specific to them, and potentially where they see people like them. And so I think when we go back to this point about men and women, it's probably a basic point that people are often better at taking care of others than they are at taking care of themselves. And so that means that those supportive relationships are incredibly important. And men and women too, but I think particularly men can drastically underestimate their own value to those around them. So how do we get this message out there to people that the most important thing that they can do is to seek help when they need it? And before we go on to a couple of kind of key summaries, if we could just look at this next slide. I think it's a really key thing to say that men may not talk to everyone, but they might talk to someone. And I think Jill, who's one of the therapists at James's place, who I think might also be here today, I was in touch with her about this presentation earlier this week, and she just gave me this line, which I just felt, the more I think about it, the more important I think it is, which is almost all men cry at least in front of me. However, I'm not sure they all cry in front of others. And I think so many things influence whether a man feels able to express his feelings, including his background, his experience, the person he's talking to. And so I think the key thing that we want people to know is there's nothing they can't say to us. There's no secret that's too awful to share. To some extent, there's nothing that somebody hasn't thought before. And so during COVID, when normal behaviours changed, it's so important to think about who that person might be, that a man might be able to speak to, that a man might reach out to, and how can we make sure that the system has shaped in order to reach him. So I want to give plenty of time for Q&A, so I'll just take 2 minutes on these last slides. But if we could move on to some key themes that have emerged during COVID. As I said, help-seeking behaviour, it has changed hugely. So we need to recognise it when we see it. And that might be in terms of digital scoping, but we also need to then to anticipate it. Can we think about where people are going to go? If they're not going to A&E, where are they going? As Joe said, lots of people reaching out to helplines. How do we make sure that they get the same outcomes when they reach out in different ways? And how we shape it needs to be dealt with caution, because we know that it's a bit like trying to change the course of a river, that you make small changes and they can have big and unintended effects. Anxiety, I think people are talking about this a lot, but it was one of the first and most consistent things that we saw happen at James's place. Anxiety levels are really high, and that influences the way that people behave across the board. So I did a piece of work years and years ago about hot and cold states for the Department of Health, and we looked at what parents in particular did when they were very anxious and what they did when they were calm. And of course, immediately, if you think about the way that we would be talking to people in a kind of, you know, in a research context, that's very different to when their child is sick in the middle of the night, for example. And we need to see to some extent that everybody is in an increased state of anxiety at the moment. And how is that going to change the way that we engage with them? I think, again, Joe's mentioned this a lot, but the role that men often traditionally take is under extraordinary pressure. And we need to think about what that's going to do in terms of kind of financial issues, but also in terms of their place in the family and in society. Because I think self-prioritization has always probably been quite poor, but people have so much to worry about at the moment that worrying about themselves may not be high enough on their list. So if we can go to the next slide, what lessons can we learn? This is just a quick summary, but behaviours change and adapt really fast, and traditionally systems don't always. So we need nimble systems that can work together in new ways and can do that fast. And I think these kinds of forums that Penny and her colleagues have brought together has been incredibly helpful, but we need to do more and we need to keep doing it. And I think we all need to listen to what people are saying. We need to hear it, listen again, and think about what that means, especially from a kind of service delivery point of view, because we can only occupy one little bit of somebody's life at any given point. And we're always competing for a huge range of things that men and their kind of wider supporters might be thinking about. So the goal is to create systems that work not towards outputs necessarily, but towards the overall outcome that we need to achieve. And we need to understand then how that will be accessed and how it will be used. And being just the final slide, and this is quite a personal way to finish, but James's Place was set up after James Wentworth Stanley died by suicide when he was 21. And I think one of the things that really drives us at James's Place is that James could have been reached, he could have been supported, he did seek help. And I think what we need to do, and what we're always trying to do at James's Place, is create that bridge to people who need that help so they can get the help that they need. That was a bit of a whistle-stop tour, but I think there should be plenty of time for questions, so I'll be looking forward to hearing that. Thank you.
Thank you very much, Ellen. Always fascinating to hear about your work at James's Place, but also those perspectives from your previous work. And I think one of the things that came from both of your presentations is this idea that it's not necessarily creating a talking space, but a space where people want to be, and where men can then either do something over an activity. Someone was saying in the chat, you know, men might talk over an activity, they might talk over food. So finding those settings, and I was thinking about men's sheds, which I mentioned before. I know football clubs have been doing more and more to reach and work with men. State of Mind is a kind of rugby league organisation working with sport to reach men. So there are lots of people out there doing some really fantastic work. So we've had some questions already, which is really fab. So I'm going to just work through some of these. So Jan asked, do we see the same loss of connection when men retire, whether it's planned or due to caring and long-term conditions? Ellen, Joe, do you have a feeling about that?
Well, I think, Joe, you've probably got some more useful kind of data and research evidence. Just from our perspective, we do see men across the age spectrum, and it seems that those key points of change do make people particularly vulnerable. So I wouldn't be at all surprised if that was backed up statistically as well.
Yeah, I'm not sure on the exact statistics, but we definitely look at these sort of things through the lens of transition points. So just as, you know, loss of your job because of redundancy, or as we're seeing now, you know, various reasons you might lose your job. There's no reason to think that retirement, forced or optional, would be different. So yeah, we certainly expect there to be sort of pinch points throughout people's lives, and for retirement could well be one of those.
It looks like, has Penny dropped off? I'm just, in which case we could go on to the next question unless she interrupts me. I think Maggie asked a question about the younger age group and being hit hardest by economic impact. I mean, certainly at James's Place, we see, I suppose, two peak groups. One is in that kind of 18 to 25, and then one is that slightly older men in their kind of 40s and 50s. And I suppose on a personal level, feel very concerned about what lockdown and the changing kind of economic climate is going to do to young people. And I think certainly we need a system-wide approach to working out, well, how do we make sure not only that help is there like James's Place when they have reached a point of acute vulnerability, but also how do we make sure that young people are better prepared for navigating some of the difficult things that are ahead of them. And I think that starts very early in primary school.
Yeah, and to add to that, we out of sight, out of mind was looking at men in, you know, middle age, that actually, this sort of came up in the presentation as well, the issues, the men that we had spoken to, by and large, been through a crisis, a number of crises, but as you tracked the issues that came up, those issues started much earlier, when men were in their 20s. It's, you know, it's and those issues were carried through, and the sort of vulnerabilities, to use a technical term, were carried through from much younger. So one of the things we're interested in at Samaritans is how do you make the services that we're talking about appeal earlier, and how do you reach these men earlier on a preventative basis, rather than sort of picking up the pieces, as it were, once you know, once a man has reached this sort of crisis point of being through a crisis, and, you know, potentially lost, you know, and relationships, possessions, and, you know, all sorts of issues.
Yeah, and I think just to add to that, you know, the men that we see have often had a fairly short-term and sudden onset crisis, and so the more prepared that people are to deal with things emotionally, and the better able they are to talk about their feelings, the easier it will be and the kind of more effective, I suppose, it will be to support them. So it does feel really kind of crucial to me. I still can't see Penny. Should we go on to the next question? Is that the best thing to do?
Ellen, you're doing a great job of sharing and answering, so yeah.
I'll ask you the question. So the next one, I think, is a really interesting question from Neil about how do we convert the need for organic services into getting men involved in those services? I mean, do those kind of services understand the benefit they can have on men's mental health? And yeah, I mean, that feels like the million-dollar question, isn't it? That you can create fantastic services, but if people don't know they're there or don't want to engage with them, then to some extent that's not helpful. And I think there's lots of things that certainly I think some of the Movember programs that I saw working really well were very kind of on the ground, very much about having grassroots work with people who are kind of delivering them and benefiting from them. I think there's something really important about exchange, that if you can support other people while you're being supported, that's really, really powerful. And I think there's also something, we haven't talked about stigma very much on this call, but I think suicide is still quite stigmatized, and very stigmatized. I think it is very difficult sometimes for people to talk about suicidal feelings. We certainly can see that, I think some of the men we see who've had a suicide attempt talk about feeling kind of very different, very out there compared to the rest of the population, and that's all stuff that needs to change if we're going to have this kind of impact, I think.
Yeah, and in terms of men getting involved, actually that was something quite striking from the men that I think that we spoke to for the research who were getting the most out of the services had started as service users, and then had sort of graduated and taken on more responsibility slowly around it. I think there were a couple of examples, quotes in my presentation about something as simple as like taking the subs for a sort of a day group for men who are on their own. That was, incredibly powerful to have gone to the Jack, to have turned up to the service, started using it, and then being given that power of that position of trust, basically. And he definitely, so those are some of the strongest, I think, in terms of like the need and reach being an issue. So, we spoke to a really amazing service on an industrial estate in Swansea. It was a kind of men's shed type offer, but people would only know it if they were inundated, but only know it if you walked through that industrial estate. You probably only walk through the industrial estate if you worked on it. So it's places doing this sort of invaluable work, but how do you, when it's literally just a workshop, where's the resource to push that out further? That's a real lots of great work going on at a very grassroots level, but difficult to sort of scale that up, and you might lose some of what's special about it if you did.
And I think there's been, we've been talking about COVID as a kind of obviously a crisis in relation to the pandemic. Oh, we've got Penny back. But there's something also really, I think, important about recognising that there have been things made available during the last 6 months that are incredibly useful. And I know that the Royal Foundation has been putting stuff out through its Frontline initiative. There are resources for young people in schools. I think Welcome has done some really, really important work in this area too. So there are things that we can learn and we can use that are more universal, but it is a question of then fitting that to the right people find it, and it's not going to the people who most usually access that kind of stuff, I think.
Hi, I'm back. Sorry about that. I had a power cut at home. That keeps things interesting, doesn't it? I'm sure I've missed some really fascinating stuff. What question should we go to next?
We just got to the question about demographic data. I haven't answered that yet.
Yeah, do you have insights into that, Ellen or Joe?
Joe, do you want to kick off with that one? I think there's some really important work underway in that field nationally, isn't there?
Yeah, so something that we call for as an organisation is for real-time surveillance. So there's a lot of there's been a lot of conjecture about the impact of lockdown and the impact of COVID on suicide rates. but the reality is that actually, because of how long it takes for suicides to become registered, to go through the coroner's process, it will be a long time until we fully understand the impact of COVID, for instance, past the anecdotal. So we know that Public Health England are starting to move towards a system of real-time surveillance, so that much quicker we can start to build an idea of suicide in terms of trends, locally, nationally, in terms of demographics. So that's something that we are at Samaritans really keen happens quickly and happens comprehensively across the country. Also, there are issues around ethnicity, for instance. So we understand far too little around suicide and ethnicity, again, because of the way that deaths are recorded by coroners. So that's something that really needs to be, we sort of call to be improved as well, so that, you know, you start to build a much deeper, better understanding about the communities that are being impacted much sooner.
Yeah. And I think just to back that up, we at James's place, and this was before my time, so again, I can't take credit for this either, but it was really rigorously evaluated right from the start, so that we could see that the right men were coming into the service and that they were leaving significantly improved. And I think the kind of data collection that Joe's talking about will be crucial, not only so that we can deal with things more quickly and closer to real time, but also that we can see patterns, and we will be able to see how things like lockdown have influenced not just rates of suicide, but rates of well-being across the board. And that's so crucial for future development and funding of services. And I think it's something that the more we can all feed in. I think anecdotal data is important too at this point.
And to add to your thought about ethnicity, Joe, also sexuality isn't recorded on death certificates. So there's a whole range of risk factors that we know that are not actually then able to be factored into lots of the evidence and the research that the ONS can do based on death certificates. So yeah, improved recording and reporting would make a huge difference to lots of people locally as well as nationally, I think. So we've got some questions about the awkwardness for men, especially older men. So I know someone else was also asking about older men and the kind of impact on them, not just middle-aged men, but what work have you guys done or know about that is reaching older men and helping them to open up and form these kinds of connections?
I think just acknowledging that there is probably a difference, that that the way that people talk and look for help, or even describe it as help, very, very much is influenced by their background and what, as I said earlier, their expectation of help will be. And I think that at James's place, because we're effectively a one-on-one intervention, the man will develop a relationship with his therapist, that's very much factored in. I think being very, very conscious about how we communicate so that we're not accidentally excluding certain groups of people is really, really crucial. And I think it'd be interesting to hear Joe's thoughts on that. Afterwards, I think Kirsty just made a kind of question in the chat about social media and its use, and I think that would be an important thing to come back to in this context too.
I can just say very briefly that in our research we found that it's about the way you frame, and this is for older men as well as younger men, but maybe especially for older men, the idea that framing support as we will help to fix you. You have a problem that, you know, we are going to sort out here, that you are going to be the recipient of care, the recipient of sitting down and talking about your feelings, might not resonate so much. Whereas if you have an activity and you're working on a shared project, and then you turn to the person next to you and start talking, and before you know it, you'll end up talking about how you feel, but you weren't brought there, you've not brought yourself there under the pretext of necessarily even talking about how you feel. It's a byproduct of something else that's going on. So it's really about how help gets framed, if you even talk about it, or whether it's just a happy byproduct of you know, it really depends, I suppose, also the stage at which a man finds themselves in. If they turn up at James's place, they may be in a different situation to if they turn up at a men's shed. So it kind of depends on where they are in that journey, as you were.
I think that's really important. And the other thing I would just add to that is that the way that somebody is presenting their distress and whether they're talking about it or not probably isn't an indication of the distress. And I think it's easy to assume that older men are feeling less anxiety or sadness or fear, but actually it's just about how you kind of make it possible for that to be communicated, I think.
Yeah, absolutely. And it really comes back to that thought, Jo, about reaching people when they're asking for help, whatever they're asking for help for. You know, if it's an addiction, to also make sure you're factoring in some of those other questions around well-being and connection and support structures, to see what else is going on for people around the specific presenting issue. And I know that's something GPs are really aware of, is if someone comes in with headaches and they've never really been in before, what else is really going on, to always have that kind of antenna up for what else might be happening. Ellen, did you want to come back on that question about social media?
Yeah, I think just to say that social media is quite a specific kind of platform. Obviously, there are variations within it as well. And there's quite a lot of this in the 2017 to 2020 PHE marketing strategy, if you are interested. But one of the things that we found when we were working on that is that, for example, social media is really good for reminding people to do things or for alerting people to do things. But it's not always very good at changing their minds or helping to develop fairly sophisticated bits of behaviour change. So I think it's just worth thinking when, especially when thinking about particular groups, yes, it's possible that they might see some messages on social media, but you probably need to do something a bit longer term and more nuanced if you're looking to have a more substantive change.
We're rapidly reaching 3 o'clock. Any comments on the new ways of reaching men and people thinking about going to pub chains? I know that the Cameron Grant Memorial Fund does some really great work with beer mats and coasters that they print information on, a kind of where you can seek support, and they put those out in all sorts of restaurants and pubs and things. But what other new ideas have people been coming across?
I mean, I just think it goes right back to that thing about thinking about where people are and what their life is like, and almost like seeing it from their perspective. We had a man who came into James's place who had been told about it at a football match, and that just feels to me like fantastic. But that is, to some extent, money can't buy outreach, because that's people telling each other about it. So I think what you're trying to do is get enough coverage of these kind of in these kind of places where people are actually existing already, so that it begins to filter through. But it's difficult.
Yeah, certainly. There's Grassroots down in Brighton. They did some really interesting work training cab drivers and tattooists, and I think the Barbers Talk Collective, which James and Bromley has just been talking about, you know, you kind of reach out into people who are talking to people, and help them have some of those skills to open the conversation up and then know who to refer to, and go to where people are. It feels like a really important thing to be thinking about. Great. Gosh, thank you all so much. I really hugely apologise for just leaving you in the middle of this session. But thank you hugely to Jo and to Ellen for giving us your time, and to everyone who's joined in and asked questions and contributed about your own services. It's been really good to hear about it. And as I said, we'll be sharing the slides and we'll put this recording on the website, and we'll let you all know. Thank you all very much for joining us. Bye.